I welcome you all to the 16th lecture of this course. This 16th lecture is on nanotechnology in point of care diagnostics. So in this lecture, we will be learning point of care test and why point of care diagnostics, and also we are going to learn various paper based diagnosis, and I will demonstrate a simple experiment to understand the lateral flow assay, and we are also going to learn the role of nanotechnology in point of care testing. So let us see what is point of care test. So it is a simple medical test that can be performed at any place by any person without the help of any medical technician, and this is in contrast with the historical pattern where you will be sending the sample to the medical lab and waiting for hours to days to get the results, and during which time care must continue without the desired information. So most of the point of care systems are based on the principle of easy to use membrane based test strips, and these are mainly useful for rapid detection of pathogens. So why we need point of care diagnostics? So here the main important property is like it gives the results rapidly, okay, and it will save a lot of time. And the next one is patient responsibility and compliance. So here the point of tests are widely self administered, so it is making the patients far more responsible for managing their own condition, and here the cost is less when compared to the conventional laboratory analysis, and but it can do only one or few different tests. So let us see the FDA definition of a simple test. So according to FDA, so the simple test should be a fully automated instrument or self contained test, and it could allow the use of direct unprocessed samples. For example, you can use the blood or nasal swabs or urine sample directly, and it needs only basic non technique dependent reagent manipulation. For example, mix reagent A and mix reagent B, you will get the result, and here it should not require any technical or specialized training, and no need for electronic or mechanical maintenance, okay. And also it should produce the results that are clear to read, such as positive or negative, and also it should contain a quick reference sheet written at the education level of the user. It should be in a simple language so that any common man can understand and he can use the particular test kit. So let us see what is a paper based diagnosis. So the paper fabrication is one of the most important technologies in human history, because this paper is widely manufactured and from the renewable sources, and it is inexpensive, and also it is combustible and biodegradable. For example, if you are making a paper based diagnostic kit for detecting the pathogens, you can, after detecting the pathogens, we can discard the kit by simple incineration. You can burn it, okay. And again, the porous structure of paper enables wicking of liquid, okay, so which is important for lateral flow assays and chromatographic applications. And this paper based diagnosis is suitable for biological applications because the cellulose is compatible with the biological samples, and this paper surface can be easily manipulated through printing, coating and impregnation, and it can be fabricated in large quantities. And another important property is this paper can be easily altered to suit our different application. So let us see the historical perspective. So this first paper based sensor can be considered the invention of paper chromatography by Martin and Sinch. So they were awarded with the Nobel Prize in 1952, and another milestone in this field was the commercialization of pregnancy test kit, okay, so which can be considered one of the most used point of care diagnosis. So this paper based kits are mainly useful for rapid diagnostics, okay. So the majority of these tests are simple and provide a yes or no answer, where response time is critical to the user. For example, in case of food safety, so if you want to know whether your food is contaminated with mycotoxins, you add a drop of food sample to the paper based diagnostic kit, and it will tell you the presence of or absence of mycotoxins. And in case of conventional technique, you have to take the sample to the lab and you have to wait for a few hours, but in case of paper diagnostic kit, you can get the result within a few seconds, okay. And similarly, it could be useful for various other applications like environmental monitoring. For example, if you want to check whether the water is contaminated with the heavy metals or some other microbes, so it can be useful for monitoring those things with a simple paper based diagnostic kit. So these are some of the examples of commercial rapid test kits. So for example, we have the kits for HIV, TB, influenza and malaria. So these are the various paper based test kits which is commercially available in the market. So, let us see some of the examples of rapid paper based test kit. So, the first paper based diagnostic device was created for urine analysis. Okay. So, these paper based urine analysis device utilize colorimetric assays to measure the glucose and protein concentration in the urine. So, here the white color of the paper provides a strong contrast, so which enhances the results of the colorimetric assays. So, you can see here this is a simple paper based rapid kit for measuring the glucose or protein concentration in the urine sample, and when we add the sample here, so if you get the color in this side, it will indicate the glucose, presence of glucose, and if you get the color in this side, it indicates the presence of protein. So, you can see here, so with respect to the concentration, the intensity of the color is getting increased. Okay. So, this is for the glucose and this is for the protein, and based on the strip reader we can easily read the color intensity, and we can estimate the concentration of glucose and BSI in the particular urine sample. So, let us see why we need paper based diagnostics. So, as I told you earlier, these are sensitive and specific and user friendly, and also it is rapid and robust, and it is equipment free. We do not need any sophisticated equipment for using this paper based diagnostic kit. Okay. So, they are mainly read with the naked eye, or if a quantitative detection is required, the equipment is small or cheap. Okay. And it is deliverable to end users and can be developed using inkjet or wax printing or screen printing technology. So, there are three types of paper based diagnostics: dipstick assays, lateral flow assays, and microfluidic paper analytical devices. So, let us see one by one in detail. The first one is dipstick assays. So, these are the simplest ones, because these are based on blotting of the sample onto a paper pre-stored with reagents. Some of the examples are pH test strips or urine test strips. So, these are simple to design and easy to manufacture, and it is very convenient to use. Okay. So, how they make the pH test strips? So, the pH test strips are manufactured by soaking a piece of filter paper into a mixture of acid and alkali indicators with a certain concentration ratio. So, after it is dried, the paper is impregnated with the detection reagents. So, when an unknown sample is dispensed on the paper, the detecting reagents react with the analyte, okay, and it will develop the color. So, by referring to a standard indicator card, the pH value of the solution can be indicated, and thus the concentration of H plus is semi quantified. So, you might have used the pH paper in your lab. So, just you put a pH paper in your any unknown solution, it will tell you the pH of the particular solution. Okay. So, it is based on the principle of dipstick assay. And similarly, the another thing is urine test strips. Okay. So, it have been designed to detect the metabolic products in the urine, so which have become basic diagnostic tools to indicate the pathological changes. For example, urinary metabolic products like glucose, protein and salt can from the patients with nephrotic or diabetic disease can be easily detected using a standard urine test strip. So, we can use this kind of urine test strips, and we can dip in the urine sample of the patient, and we can easily analyze the presence of glucose or protein or the salt. So, next one is the lateral flow assays. Okay. So, this lateral flow assay have all the reagents pre-stored in the strip. So, it is also similar to the dipstick, but it will also integrate the flow of the sample. So, here the flow passes through the different zones of the strip, which have different reagents for different function. So, usually this lateral flow assay have 4 different parts. The first one is sample pad, the next one is conjugation pad, and third one is detection pad, and fourth one is observant pad. So, the sample pad is mainly made up of cellulose, and it will filter the sample from impurities, and it stores the dried as a buffer. And next one is the conjugation pad. So, it is made up of glass fibers, and it is used as a dry reagent storage for the labels, and in this pad the binding reaction between the labels and the analyte starts. Okay. So, in the detection pad, it is made up of nitrocellulose. The capture reagents are fixed, and the signal is developed in this detection pad. And fourth one is observant pad. It is made up of cellulose filters. So, the function of the observant pad is to wick the fluid through the membrane. Okay. So, in this way the amount of sample can be increased, resulting in an increased sensitivity. And this lateral flow assay is available in 2 formats, sandwich and competitive. So, usually the sandwich format assays are mainly utilized for analyte with multiple antigen epitopes, and this competitive format assays are designed to detect and analyte with a single antigen epitope. So, let us see the lateral flow assay in detail. Okay. So, this lateral flow assay contains 4 different pads: sample pad, conjugate pad, and membrane and wicking pad. So, in the sample pad we will be adding the sample, and in the conjugate pad it contains antibodies conjugated to the gold nanoparticles or latex microspheres. And here the sample and antibody everything move in this direction using the capillary force, and in the test line we will be having the antibody which is specific for your antigen, and in the control line you will be having the anti-IgG antibody, okay, so which is specific for your gold nanoparticles conjugated antibody. So, when you add the sample, so the antigen present in the sample will bind with the antibody in the conjugate pad, okay, so it will move towards this test line. So, in the test line, so this antigen will be sandwiched between 2 antibodies. All the unbound antibody will move to the control line where antibody reaction will happen, okay. So, let me explain the lateral flow assay one more time in detail, because most of the commercial kit is based on lateral flow assay. So, here in this lateral flow assay we will be having sample pad and we will be having conjugate pad and below that you will be having nitrocellulose membrane and here we will be having absorbent pad. And in the nitrocellulose membrane we will be having test line and control line. So, when we add the sample here, so the sample contains the antigen. So, this sample will move in this direction through capillary force, and when it reaches the conjugate pad, in the conjugate pad you will be having antibody conjugated with gold nanoparticles. So, here in the conjugate pad, so this antigen will come and bind with the antibody which is conjugated with gold nanoparticles, and this antigen antibody complex will move in this direction. So, when it reaches the test line, so in the test line you will be having antibody specific for your antigen. So, this antigen antibody complex will come and bind here. So, your antigen antibody complex will come and bind, and your antigen will be sandwiched between the 2 antibodies, okay. So, here you will get a color line, and this unbound antibody will move to the next line, that is your control line, okay. So, this unbound free antibody, conjugate antibody which is having this gold nanoparticles, it will move to the control line. So, in the control line we will be having anti-antibody. So, this antibody is specific for your this antibody, conjugated antibody. So, this conjugated antibody will come and bind here. So, it form a color line here. So, your positive sample you will get 2 lines, one is your test line, next one is your control line. So, this control line confirms your kit is working properly and the sample flow is in the proper direction. So, here in the test line you will be having antigen antibody reaction, and in the control line you will be having antibody reaction, okay. So, this is a basic principle of lateral flow assay. I hope you understood the principle of lateral flow assay. So, this is a typical schematic view of lateral flow test strip, okay. So, it is having this kind of arrangement. If you open the kit you will have this kind of arrangement. I will open and show you how it look like. So, the sample pad you can see the arrangement is like a strip like arrangement, and below the sample pad you are having the conjugate pad, and followed by you are having the nitrocellulose membrane, and this nitrocellulose membrane is having a test line which is having the antibody specific for your antigen, and in control line you are having antibody. So, that antibody is specific for your antibody, that is the conjugated antibody. Okay. And this one is the observant pad, it will observe the excess sample. So, let us see the simple experiment to understand the lateral flow assay using this pregnancy test kit. So, here we will be using this urine sample of pregnant woman. So, the urine sample of pregnant woman contains HCG, that is human chorionic gonadotropin. Okay. So, when you add the sample here you will get 2 lines. So, the 2 lines indicate the positive result, and in the other one we will be adding this simple water where there is no antigen, and you will get only formation of line in the control line. So, for the positive sample you will be having the 2 bands, control band and test band. Okay. And in case of negative you will get the band only in the control line. Okay. And if there is no line, the test is invalid. So, I will show you the demonstration of lateral flow assay using the pregnancy test kit. So, you can easily understand the concept of lateral flow assay. So, let me explain the principle of lateral flow assay using a simple pregnancy test kit. So, first I will open this pregnancy test kit. I will show you the arrangement of various pads in this kit. So, as I told you earlier, this lateral flow assay contains various pads. The first one is your sample pad, so where your sample will be loaded, and this one, this color one is your conjugate pad, where your antibody is conjugated with gold nanoparticle or some color beads, and the below one is your membrane, nitrocellulose membrane. So, where you are having the test line as well as the control line. Okay. So, the test line is containing antibody specific for your antigen, and this control line, it is having antibody specific for the conjugated antibody, and this is your observant pad. So, this will observe the excess sample. Okay. So, in this 2 kit, in the first one I will add only the water. Okay. So, this is a sample port. So, where I will add the simple water. So, when I add the water, the sample will flow using the capillary force, and in water there is no antigen. So, you will get only one line. So, you will get line only in the control. You can see here, this is a C is the control and T is the test line. So, you will get the line only in the control. You can see here the formation of color line, that is only in the control you are getting this line. Okay. In the other kit I will add the urine sample. So, in the kit where I added the urine sample, you will be able to see 2 lines. So, one is for test line, another one is for control. So, if we have 2 lines, that means the particular person is pregnant. So, you can see here you are able to see 2 lines, right. So, one is for the control and one is for the test line. You are able to see the 2 lines in case of urine sample, and in case of water you are able to see only 1 line. Okay. So, we are getting only 1 line in the control, and in case of urine sample you are able to see 2 lines. So, by using simple experiment you are able to understand the concept of lateral flow assay. I hope you understood the concept of lateral flow assay. Now, we move on to this microfluidic based paper analytical devices. Okay. So, these micropads are made by patterning paper with variety of assay designs. So it is mainly based on capillary force to drive the aqueous fluid movement. So we can make the 2-dimensional or 3-dimensional micropads, and these 2-dimensional micropads are made by patterning physical or chemical hydrophobic boundaries to form the microchannels on the paper. And various approaches like including cutting or wax printing can be used to create the channels and barriers in the paper. And here the reagents required for biochemical reactions can be immobilized on the paper with different patterns. For example, we can make a 4-leaf clover by hand dispensing or inkjet printing technology. And when the reagents are dried, the paper based devices can be used for biochemical analysis. So these 3-dimensional micropads are produced by stacking layers of patterned paper in such a way that channels in adjacent layers of paper connect with each other. And compared to the 2-dimensional micropads, these 3-dimensional micropads have several advantages. So due to their capability to incorporate complex networks of channels and thus providing multiple functionalities. So this is a typical example of 2-dimensional micropad. So this is a channel, okay, and this channel can be created using photoresist or wax, and this is a test zone. And when you add the sample, so it can detect the glucose or the protein in the urine sample or any other sample. And this is a 3-dimensional micropads, okay. So here it is having multiple channels and which could be useful for detecting multiple pathogens. So let us see the comparison of different paper based diagnosis techniques. So each has its own advantages as well as disadvantages. So the dipstick method is easy and fast optimization, but the problem is it is only optical detection, so there is no quantification. And this LFA, it is versatile and it is based on the flow, lateral flow, okay. And here we can also do the electrochemical detection, and the problem is long optimization times and also the long fabrication. And when you use this micropad, so it is versatile as well as it is having this different detection methods, and the main advantage is the sample volume is here it is less, we can use only 10 microliter of sample, but the drawback is it need long optimization times. And this paper based diagnosis also categorized based on their reaction. It can be categorized into chemical, biological and electrochemical. So the most chemical reactions with the color change can be achieved on paper, such as acid alkali reaction or precipitation reaction and redox reaction. So which I already explained to you with the example of pH test strips. The next one is the biological reaction, antigen antibody reaction. So the example is the home pregnancy test kit where the antigen antibody reactions happens, okay. So the same idea could be useful for measuring the tumor markers as well as for diagnosing various infectious diseases. So the next one is the biological reaction by nucleic acid hybridization, that is NAT. So here this NAT assay requires 2 types of oligonucleotide probes. First one is detector probe, the next one is capture probe. And this detector and capture probes are both complementary with target nucleic acid sequence. And here the detector probe is used to combine with a tag to make the reaction visible or measurable. And here the tag can be colored particles or it can be gold nanoparticles for colorimetric assays, and it can be electroactive molecules, for example thionein, for electrochemical measurements. So using this NAT assay we can easily identify the genetic as well as infectious diseases. So let us see what is electrochemical reaction. So here this electrochemical detection can be achieved on the basis of both redox reaction and non-redox reactions. So the redox reactions are involved in electron transfer between the molecules or particles, and these non-redox reactions are related with the changes of electrical properties. For example, impedance or resistance will get changed. So the most successful example of electrochemical detection is the blood glucose meter. So this glucose meter is an amperometer, okay, and it measures the quantity of electroactive species as a result of oxidation of glucose by reagents stored in the test strips. So this test strip is impregnated with glucose oxidase and other components. So when you add a drop of blood, the glucose oxidase catalyzes the oxidation of glucose, and the glucose meter quantifies the electrons generated by the oxidation and correlates them to the level of glucose in the blood. So let us see the role of nanotechnology in point of care testing. So in the paper based biosensors, so the nanometers are mainly used as labels or carriers, So, the gold nanoparticles have been mostly used, and because these gold nanoparticles have excellent labeling property and easy functionalization, easy manipulation, and also it is biocompatible, and it produces a strong red color, and it also have a characteristic surface plasmon resonance and electrochemical activity. And some of the other nanoparticles like magnetic nanoparticles, quantum dots, liposomes, carbon and ceria nanoparticles have also been explored for point of care diagnostics. So, let us see the example of nano biosensor for protein detection, and here we can detect the thrombin. Okay. So, this is also similar to your pregnancy test kit only, and the lateral flow assay, you can see here sample pad, conjugate pad. Okay. And here instead of antibody we will be using this aptamer. So, the aptamers are oligonucleotides or oligopeptides, so which is specific for the particular protein. Okay. So, you can see here when you add the sample with thrombin, you are getting 2 lines. Okay. In the test zone as well as the control zone, you are getting the line, and here this sample without thrombin, there is no line in the test zone. So, using this strip reader, we can easily quantitate the amount of thrombin present in the particular sample. So, the next example is we can use the quantum dots. So, you can use the quantum dots also for diagnostic applications, and we can measure the fluorescent intensity using the strip reader. So, the next example is nano biosensors for cell detection. So, here the cells cannot run intact through the pores of the membranes, so but they can be attached to the surface of the paper. So, using this we can detect the pathogens like Pseudomonas or Staphylococcus bacteria, and where we will be using these gold nanoparticle functionalized specific antibodies, and it can detect 500 to 5000 colony forming units. So, the common diagnosis for diabetic patient is urine test or blood test. Okay. So, the urine test will give the qualitative results, and blood test will give you the quantitative test, and this blood test can be done by finger pricking method. So, here the sample is the whole blood, it is placed on a chemically coated strip of paper, and which can be visually tested. So, but the major drawback is we have to prick your fingers every day to measure the glucose level. So, it is a little bit a painful situation for the patients with diabetics. So, to overcome this invasive techniques, so scientists from Leeds University, they have developed a non-invasive device. Okay. So, that could end your daily fingerprinting for people with diabetes, and they have used a nano engineered silica glass with ions that fluoresce in infrared light when a low power laser hits them, and when the glass is in contact with the user's skin, the extent of fluorescent signals varies in relation to the concentration of glucose in their blood. So, here the device measures the length of time the fluorescence lasts for and uses that to calculate the glucose level in a person's bloodstream without the need for a needle, and this process takes less than 30 seconds. So, instead of pricking your finger, so it is similar to your biometric device, you just keep your finger on that device, and within 30 seconds it will estimate the blood glucose. So, next one is continuous glucose monitoring system. So, this is a tiny sensor, so which can be inserted under the skin, and it will send the information about the glucose level through the radio waves from the sensor to a pager like wireless monitor, and it will help the patient and doctor, and accordingly they can take the insulin. So, how the monitoring system works? So, here a circular patch is placed on the upper arm with a special applicator every 2 weeks. Okay. And this tiny filament pierces the skin and measures the glucose level in the interstitial fluid between the skin cells, and the readings are sent to a reader through this NFC wave, that is a near field communication waves. This is the same technology which we use for contactless card payments. Okay. And this data can automatically be sent to up to 20 other phones. Okay. It can enable the patients to keep an eye on their children when they are at school. So, here the benefits of CGMS is like it has increased security for alarms and alerts, and here we are getting the immediate feedback. Okay. And also the blood glucose trend provides more information than the static readings, and here the sensors can be programmed. If it is a low glucose or high glucose, it can make some alarm. So, recently this Google made a smart contact lens. Okay. So, this contact lens have a sensor. Okay. And this can detect the glucose in the tears. So, this technology uses a small nanoparticles which is embedded into these hydrogel lenses. Okay. And these engineered nanoparticles react with the glucose molecules in the tears, and it causes a chemical reaction that changes the color of the lenses, These tiny sensors will send the information about the blood glucose to your mobile phone, and also the color of the contact lens also get changed. So based on the color also we will get an idea. So what is the sugar level in the blood. The another thing is nano tattoos. So we can inject the nano ink into the skin and external device to measure the and translate this fluorescence. So here this change in fluorescence depends on the blood sugar. So we can inject this sensor using the minimally invasive technology. Okay. So once it is injected, the tattoos are made, okay, and it can measure the sugar level as well as the sodium level in your blood. And we can have this portable optical reader. For example, we can use this modified iPhone case, okay, which can be used to detect the sodium levels through this nano sensor tattoos. So next one is we can also use this nanotechnology sensor to detect the type 1 diabetes in the breath. So acetone is usually found in the healthy person's breath, approximately 900 ppb, that is the particles per billion, okay, but the concentration is double in case of type 1 diabetic patient. So here we will be using the substrate with gold electrodes, coated it with an ultra thin semiconductor film made of nanoparticles, and here this tungsten oxide mixed with silicon is mainly used, okay. So in presence of acetone, the electrical resistance of the material drops, okay. So depends on the electrical resistance, we can easily detect the diabetes in the breath of the particular person. So based on this electrical resistance based breath sensor, we can easily identify the person with the type 1 diabetes. And we can also use this lateral flow chip to diagnose the malaria. So usually the microscopy has been considered as the gold standard for diagnosing malaria, but for using the microscope we need a lab setting as well as a well trained researchers. So to overcome this drawback, we can use this nano or microfluidic technologies. So here we will be using this antibody which is specific for the malarial parasite, and here we will be using this blood sample, okay. So if there is 2 lines, that means he is positive for the malaria. So let us see how we can use this magnetic nanoparticles for detecting the TB, that is the tuberculosis bacteria, and this usually the magnetic nanoparticles are dispersed, and in presence of TB this will form like a cluster. So due to these clusters there is a change in the NMR signals. So this is a microfluidic NMR biosensor, so which could be useful for detecting the change in the NMR signals. So let us see how we can use this technology in diagnosis. So we can use a simple phone camera, and that can send the result of the assay to a laboratory, so where a specialized person can analyze it and send back the result. And this type of technology can tremendously enhance the healthcare in extreme places like the developing world and battlefields, so where not always the possible intervention of specialized people or the use of expensive measuring instruments. So here we can use the normal camera as an imaging device, so that will digitize the result and transmit them to an expert, and an expert will interpret the results and replace with the treatment. So let us see the advantages of nano or microfluidic technologies. So here these nano or microfluidic technologies have been successfully integrated with the current POC devices for on-chip diagnosis and also for monitoring various infectious diseases at resource limited settings. And these POC diagnostics have significant advantages over conventional diagnostics, such as reducing the cost as well as increasing their portability and disposability. And again, future trends in diagnostic focus on extending the availability to decentralized hospitals and also to the rural areas more effectively where wireless networks are available. So as a summary of this lecture, in this lecture we have learned what is point of care test and various paper based diagnoses, and also we have seen the demonstration of lateral flow assay using a simple pregnancy test kit, and we have also learned various roles of nanotechnology in this point of care testing. Okay. So I will end my lecture here. I thank you all for listening to this lecture. I will see you all in another interesting lecture.